Today's presentation will include myself, Dr. Jonathan Dixon, Dr. Nicholas Martin, both from the University of Sheffield in the UK, and acknowledgement to our colleague, Dr. James Field, who helped put some of this information together on both sides of the ocean as it relates to us. So my presentation will begin by discussing, just giving you a broad overview of what the challenges are currently and a case study from our institution, University of Pennsylvania in Philadelphia, USA, as it relates to our efforts to incorporate One Health and environmental sustainability into our educational program. So education must evolve. We are facing a lot of challenges. A lot of things are coming at us quite quickly. It's a busy slide by intent because ultimately we're experiencing a lot of different challenges from all aspects. AI, technology, the push to digital dentistry, an imperative focus to focus on patients' individuality, the social determinants of health. And from the standpoint of today's discussion, climate change. Climate change is not an issue uh, uh, that can be ignored any longer. We need to figure out ways to educate our students about some of the challenges that they're going to face, not just from a practice standpoint, but from the patient's perspective, more importantly. I'm not going to belabor the point. We're all aware of some of the challenges we've been experiencing as it relates to weather phenomena. In the US, coastal flooding has been quite significant. I'm just going to touch on one recent natural disaster. Jamaica was hit by the worst hurricane, the strongest hurricane in the history of that country, just about less than a month ago. I reached out to one of my colleagues, one of the dental schools in Jamaica. It's only two dental schools in Jamaica, wishing them well, wishing them health and safety before the hurricane hit. And she reached back to me on this past Friday, almost 3 weeks later, to let me know that they're doing okay otherwise, but they've been devastated, not just from pictures on the screen, the newspapers or on TV, but on the ground. Their dental school shut down for more than 2 weeks due to flooding. Their students were not able to go to school. Their patients were being treated. These are the challenges we're all facing. In the USA, last year, Florida was hit by 3 hurricanes in a period of 2 months. About 6 years ago, Puerto Rico was hit by two Category 5 hurricanes in less than 2 weeks. These are challenges that our students need to understand and how to face and how to address as they move forward in their own careers. So climate change, on at least on this side of the world, has had some hiccups as it relates to government policy, depending on the government in charge. We've been waffling back and forth as to its importance to be addressed by institutions here in the US. I'm Canadian, so in Canada, we're having less of an issue as it relates to governmental um, importance placed on climate change and the need to address it. Overseas and certainly in Europe and the UK as a whole, a bit more importance being given to climate change. This is a slide that was issued by WHO, I believe it was last year, as it relates to the challenges of climate change to overall health and well-being. I'm not going to go through the details of the slide. If you're interested, the reference at the bottom of the slide itself. But to illustrate that climate change is impacting human health in a variety of different ways, oral health included. And so with that said, we need to equip the next generation of learners with the ability to think outside their small world of clinical dentistry. We need to equip our students and future practitioners with the ability to integrate their learning in a transdisciplinary and interdisciplinary manner. We need our students to understand the upstream causes of disease, promote health equity, implement sustainable clinical practice, and as importantly, to develop a resilient and adaptable workforce for the future generation. Our goal is not to replace core dental. Our goal here is to expand professional identity. And it's important to understand the inclusion of this education in or these topics in dental education is not It cannot be just a passion project. If it's a passion project, then tomorrow, if you're no longer passionate, the goal here really is to equip the next generation of learners and practitioners with the skills needed to understand the upstream causes of disease, promote health equity, implement, very importantly, sustainable clinical practice, and overall to develop a resilient, adaptable, and a grounded workforce with the understanding of the need to be vigilant, not just in their local environments, but beyond as well. Our goal here is not to replace the core dental sciences, is to expand the identity of the practicing dentist. And as Dr. Dixon clearly showed, this can't be a passion project. Because if you're not passionate, if you're no longer passionate tomorrow, it'll disappear. It has to be embedded fully within the curriculum in order to make it a sustainable initiative. And so Dr. Dixon, Dr. Martin talked about environmental sustainability. That's proven to be the operational backbone for how we achieve One Health and planetary health, or the goals of One Health and planetary health. One Health is a relatively recent concept, at least here in the US, as it emphasized the fact that we are interconnected with our environment and with animal health. Human health is interdependent upon the health of animals and our environment. Healthy animals, healthy environment, healthy humans. And working in the framework of One Health allows cross-disciplinary, transdisciplinary, interdisciplinary partnerships to help address these important goals. Planetary health is the overarching goal, the overarching importance to examine how global environmental changes impact human health and well-being. And operationally, both One Health and environmental sustainability fit nicely into the planetary health mindset. So these provide some very important frameworks for how we can develop lectures, programs, initiatives within dental education that does prepare students better, well, certainly prepare students for the challenge they're going to experience as they go into practice tomorrow and beyond. As Dr. Dixon emphasized from their own surveys that they conducted, the common theme was, there's no time in the curriculum to do this, that this is not really that important to be included in dental education. Some faculty acknowledged a lack of expertise to move this forward. Just as an aside, I proposed a program to the ADEA national meeting in March to describe what we're discussing today and some of our initiatives at Penn, and it was rejected with the comment being the topic is too niche. There's a bit niche. It's not niche. And to me, this is kind of short-sighted. In as much as here DIA and ADEE released a joint statement in publication back in late summer, reinforcing the need for both organizations, national organized dentistry, to move this forward. And here, ADEA rejected this proposal. Kind of ironic. So within Penn Dental, at my institution here in Philadelphia, Pennsylvania, certainly within the school, we're doing quite a few things to make ourselves more eco-friendly. We have a very robust teledentistry program and digital dentistry program with limited amalgam throughout our institution. We reduced PPE usage in the preclinical stimulation environments. We reduced plastic usage in the clinics. We've considerably dropped the number of gloves we're wasting just because we no longer mandate gloves in our simulation environment specifically. But like Dr. Dix described, we needed to take this one step further and put this into our educational program. This is a busy page. Our program was written up in our local dental journal. If you're interested to read about it, it's at the links at the bottom of the screen. But I led the effort 3 years ago. We began the effort in 2022. And two of our guiding principles on day one in our first meeting with my colleagues in the committee that we want to ensure that our new curriculum reinforced was the social and environmental determinants of health as it relates to clinical practice and to promote and improve health equity. And on day one, we emphasized the need to incorporate principles of One Health climate action, sustainable development, sustainability into our actual curriculum. Not as a single course, but weaved longitudinally throughout the entire four-year program here at Penn Dental, much like what Dr. Dixon already described. I'm not going to go through what we did specifically as it relates to the courses, but in a nutshell, all of our courses are now fully integrated. Each course is a general theme, and within that theme include instruction from all these potential disciplines across the school: surgery, medicine, pathology, basic sciences, orthodontics where appropriate, as long as those lectures and that content met the theme of the course. Within these broader themes, we incorporated lectures that are focused on One Health, on sustainable development, sustainability, and planetary health within the concept of the actual theme of the course. So without describing the courses, like Dr. Dixon described, we now have 18 lectures to date, 18 lectures / topics that are weaved and integrated throughout our entire curriculum to date. The lectures listed on the screen that are bolded are in fact brand new lectures we incorporate into our curriculum when we launched the curriculum last year. And we keep adding new topics as we go forward. In fact, climate change, mental health, and resilience was added this year to a course, and we're adding disaster preparedness to a course in the spring for third-year students. I also emphasize here that we've taken an approach of, if we're not the experts, we'll get the experts to teach. And so we are not the experts in some of these topics, but we felt they're important to incorporate into our curriculum. So we recruited faculty from the veterinary school here at Penn, the nursing school, and school of medicine here at Penn to provide these lectures to our students. So lectures that sort of the highlighted acronyms on the right reflect that the faculty who help teach these lectures from across the schools here at the University of Pennsylvania. Beyond that, this year, in fact, beginning in January, we will now require our second and third and fourth year students to take 2 treatment plans that they've developed for their patients, and in a presentation style or an actual write-up to reflect on the environmental impact of those treatment plans and to suggest and recommend sustainable alternatives. We're not asking our students to change their guidance to our patients or to their patients that they've treatment planned. We're not changing treatments based on environmental impact, but we want our students to understand the impact to the environment that their plans are potentially going to cause. Whether it's machine implants, whether it's the lack of recyclable materials for partial dentures, complete dentures, whether it's the energy needed to produce resins and dental materials, the plastics. We want our students to reflect on the cost, the environmental cost to the treatment plans, and to offer reasonable alternatives. Ultimately, this is really, for today at least, is to increase awareness amongst our students and faculty included. Tomorrow, it may be a patient comes to their office asking for a sustainable alternative to what the initial proposal was. That's cost effective. So again, we started this initiative in January for our second, third, and fourth year students. Beyond that, we've already mapped our entire curriculum, or at least our classroom curriculum, to the United Nations 17 Sustainable Development Goals. The SDGs were proposed back or adopted back by the 2015 by the United Nations, with the goal to end poverty, protect the planet, and ensure by 2030, 5 years from today, that all people enjoy peace and prosperity. We're far away from that lofty goal. It was a very important goal to strive for. We've taken it one step further here at Penn, again, to increase awareness amongst both students and faculty as to how and what we teach reflect these very important sustainable development goals. And so last year, we created this mapping of all our courses. This year, we now include the SDG map in our course syllabi. So the last portion of the course syllabus reflects how each of our courses touches or addresses some aspects of the SDGs. So in this case, I show three courses on screen, one in first, second, third year, respectively, and the SDGs highlighted in red are the SDGs mapped by each of these courses. In both in the second year course and third year course, there are lectures focused on gender equality, transgender health, women's health, and that's how those lectures touch, and that's how those courses touch on the SDGs. We are in the process of writing this up for publication purposes. I hope to have this submitted for publication for review by end of this academic year, end of the calendar year. So as Dr. Dixon described, the next step really is to measure outcomes and impact. We're nowhere near this point yet. We really are quite early in its infancy with this initiative. Getting it off the ground was a major step for us, a major step forward. The next step is to measure, as Dr. Dixon described, what the impact is in our students and our faculty as it relates to change in behaviors, change in perceptions, as it relates to monitoring the impact in more practical terms, whether students are engaged in research initiatives that touch on these important principles, whether they're participating in workshops to increase their own understanding. And certainly institutionally, we've already started tracking usage of waste or waste production. We are trying to reduce waste overall. We certainly moved a big way towards that goal institutionally. But from our perspective, we are a major research institution. We would like to see scholarship as relates to these very important principles. So really are very early in the process. We are looking to plant seeds in the hope that we start changing some hearts and minds and start developing interest. And hopefully at some point as these students become practitioners, that they take these principles to heart and start making changes in their own practices for their own patients. Good. So my last slide here, we want dental education to transcend clinic walls to meet emerging health challenges. Things are changing quite rapidly. We need to create a future-proof education. Most schools currently don't have that ability in the current programs. It did take an institution-wide initiative and interest to change our curriculum for the next generation. I've led 3 curriculum changes in my 15 years here in administration here at Penn Dental, not because of weaknesses, but because of the need to incorporate the next version, the next modern innovations. As Dr. Dixon described, we have a wall-to-wall curriculum, or at least had a wall-to-wall curriculum with very few hours to accommodate new instruction. By changing what we did into this new version, we created hours of availability, not at the expense of what we're teaching, but by reducing redundancy, by reducing repetition, by shifting how we teach things, when we teach things, by creating hours in each academic year to incorporate additional content that currently includes AI-related lectures focused on AI usage. Certainly several lectures, as just described, focused on One Health and sustainability. And so now we have time in our curriculum and more as needed to incorporate the next innovation that comes to our attention. We need to, as we just described collectively, we need to reframe training from just drilling and filling. There's now, next year will be 81 dental schools here in the US. A lot of these new schools really are focused on drill practice, drilling and filling for all intents and purposes. Very few of these new schools will be research driven. I'm very proud to say Penn is a very research driven institution. We're evidence based. Everything we do here within the school is evidence based. And now this next version of our curriculum, this new version of our curriculum, We've now reframed how we're training our students to make sure that they are walking out of here understanding the challenges, understanding how it is that they can help address these challenges, even within their own small eco systems. But the goal is to start small and expand from there. And to do so really does require a cross-institutional collaboration. I look forward to working with Doctors Martin, Dixon, Field going forward. We have a publication that we've submitted together. We look to it will publish next year in JADA. It does require an effort. And the question is your institution ready to make the effort? We were here at Penn. Clearly, the groups in Europe are ready as well. This will take not just 2 schools, 3 schools, 4 schools. It'll take all schools to really make a difference. So I'll stop there. I know we're a bit over time. I do apologize for my technical issues. But before we close here, Drs. Dixon and Martin, um, uh, what's next in your opinions? What's next? How do we make a broader, how do we get a broader push? So it's no longer a niche, quote unquote niche topic.
I think that the way we need to get abroad, it is niche and it is considered a bit geeky as well. People think environmental sustainability is a bit special and people are a bit embarrassed to talk about it or indeed engage with it, perhaps. I think the way forward is to really work with our colleagues that are developing documents like we saw before, like the Bangkok Statement and the WHO Strategic Planning for Healthcare, and making sure that policy writers and guideline legislative organizations understand that clear link between good quality oral healthcare prevention and environmental gains, so that environmental sustainability is embedded automatically into that, and trying to get more into the psyche, just normalize the whole concept. That is, it's not something magical that people have to do over and above, and that makes them special is difficult. The raw tools are there in just good quality care. And of course, there are plenty of other aspects, like, for example, ways of reducing nitrous oxides or plastic reduction, lots of other things we can also do. But it is that normalization of the concept and integrating it, as you said, into One Health and public and global health, so it becomes core. So oral healthcare, sustainability are like that. They're totally embedded with each other, intrinsically engaged, and one is part of the other. I think that is where our direction of travel needs to be.
Thank you,
Yeah, I
Dr.
completely agree. I feel normalizing is absolutely critical. So having events frequently is making it a part of daily life is critical, but also empowering our students to make them realize this is possible to do this, but also empowering institutions and giving them guidelines and resources, again, to demonstrate really that it's possible. You can teach this. It is an achievable goal, is my perspective.
I want to share my last slide here. Um, so this is from our manuscript that we submitted or will be submitting soon as recommendations to memorialize and to operationalize this vision to make it more than just a niche topic. We need to develop, well, certainly secure leadership support. I'm very proud of my dean here at Penn Dental, very supportive of this initiative. Clearly, internationally, the FDI is understanding the challenges. WHO certainly understands the challenges. It's to get that level, to go from there down to the boots on the ground, so to speak, which these being schools. We need our institutions to show that this is important, to recognize that this is important. We need accrediting bodies to recognize that this is important in order to legitimize curricular changes. We need to develop an approach. I would argue much like what we're doing here at Penn, where We are finding the experts within your institution, within your university as a whole, to bring them into school here to show that this is not just a dental concern. It's not just a concern of Dr. Lowy as the acting dean. That this is being regarded as being important across the entire institution. And so we are now, in fact, the university has created a One Health certificate program that is drawing students from across the entire campus into this program. We are investing in faculty development. We are forming interdisciplinary teaching teams. I co-taught one of my lectures with my colleague from the veterinary school as one example. The goal here really is to broaden the scope, but not in a way that is going to be foreign to our students, but in a way that's meaningful to our students. In fact, the lecture I gave with one of the colleagues from the vet school was focused on oral health. But here she's a veterinarian talking with a dentist about oral health. And her perspective is very different, but nonetheless, it's very important for our students to hear. As Dr. Dixon described, developing case-based modules, evaluation tools that assess systems thinking, sustainable literacy is also equally important. I really like the models that they put together, the surveys they put together. I'm going to steal those surveys for our own purposes here at Penn. Why recreate the wheel? But nonetheless, the impact, the evidence to support that this is making a real difference is important to develop. And we didn't mention here today, but the Planetary Health Report Card was started by a group of students at UCSF in California. Further expanded upon by Dr. Martin's team at Sheffield to include oral health. Students, this generation of students, next generation of students are the ones who are really helping to drive these initiatives forward. And so if they're walking in with the intent to understand some of these global challenges, we need to be ready to accommodate their interest and their interest in moving this forward. And so we took that mindset when it came to our change our own curriculum by thinking about our students and how our students are walking in with the interests that they have as it relates to climate change, as it relates to artificial intelligence, digital dentistry, and ensure that our curriculum is hopefully future-proof going forward. We have enough accommodation in our curriculum currently that we've created that the next innovation, the next big thing that's important to practice, we'll be able to accommodate in our future curriculum as well.
So thank you very much for the opportunity to introduce you to this subject, and hopefully for those of you that are more familiar with it, explore some areas. As Faizan was identifying, we're going to be focused on education, but this does give me an opportunity to focus on some key messages that we want to explore, both education, and when we talk about education, it is at all levels, not just undergraduate, postgraduate, and also within our professional community. So myself and my colleague Jonathan Dixon, that will join us shortly. We come from the United Kingdom. We're based in Sheffield, which, as you can see by the arrow, is right bang in the middle of England. And this is a little picture of our university campus. This is me, and one of my other roles is that I work with the Sustainability in Dentistry Task Team for the FDI World Dental Federation, and I have the privilege of chairing that group of colleagues at present, and we are engaging in a number of altruistic resources for the profession in many different forms. And I would urge you and anybody who is interested in this topic to visit the website to see a whole host of resources and material that's open access for the public. Faizan was touching on the point that essentially everything we do has environmental impact, and that in dentistry and oral healthcare, we're not immune to this, and we must we must also engage with our environmental sustainability ethos and philosophy in a practical and impactful way. The message is that we obviously cannot eliminate an environmental impact, but we can mitigate it to a sustainable level. And that is really an important message, that everything we do we must be thinking, how can we mitigate the environmental impact for the future of the planet and future generations? This is something that was identified at the IPC last year, where we're looking at mitigation and adaptation options across all systems. And one of the key messages that came from this that I have highlighted is a rapid and far-reaching transitions across all sectors and systems are necessary to achieve deep and sustained emission reductions and secure a livable and sustainable future for all. The message here is across all sectors, and that is us, oral healthcare. Oral healthcare has a significant impact on the environment, and you may well be familiar with these graphics and this data that was produced. The pie chart on the left identifies carbon emission equivalents, and you see that the two largest elements of the pie chart are patient travel and staff commute. That equates for approximately 60% of carbon emissions. And this is a study that was undertaken by Brett Duane and colleagues in England about 3 or 4 years ago. On the right-hand side, there's a study that I undertook with some other colleagues, and we quantified the amount of single-use plastics generated in clinical dental practice and hospital sites. And again, you see, we did it by procedure and the number of items, and also by mass. So essentially, the message here is, without getting too hung up on the numbers, is that the provision of oral healthcare has a significant environmental impact. And we need to understand this so that we can mitigate it. And this essentially is our current baseline. So the learning objectives from this presentation again deliver is that environmental sustainability can be mitigated through good quality care. And for this, we have created a framework that deals with 4 topics: preventive care, good operative care, integrated patient-centered care, and ownership of care. And I will explore these in a few moments as the presentation proceeds. Key to this is that all of these things, the environmental sustainability impact, is something that we get, I've called it something for nothing. Essentially, if we do what we've been trained to do, and we train our future generation of dentists to do, and our colleagues in dental surgeries around the world do well, if we do good dentistry, and by preventing it, by doing procedures well, integrating our patient care and owning our care, then that is something for nothing. We don't need to really worry about much more. So now we are at an interesting crossroads, in that we've got 2 very interesting, call it the policy guidelines or strategic declarations. This on the left, the Global Strategy and Action Plan on Oral Health, which is a really, for the first time, it really cements a strategic plan for oral healthcare on a global basis. And we have the Bangkok Declaration, where basically oral health is inserted into the ethos of general health as well. And these 2 provide an important framework for the provision of oral health care around the world. I've highlighted here a couple of components. In the Global Strategy Action Plan, you see you've got oral health promotion and disease prevention as a key element of this. Now, I'm focusing on this area because, as you see, it resonates with our framework of preventive dentistry, preventive oral healthcare, as a single most important measure to mitigate our environmental impacts. The other one is oral health and environment, which is how it identifies the link between the 2 very effectively. The Bangkok Declaration has a strategic objective of oral health governance, and then the second strategic objective of oral health promotion and disease prevention. Again, that word prevention keeps coming up time and time again, because we understand from a global perspective that is probably the single most important thing that we need to do in order to optimize the health of the world and minimize financial impacts, if nothing else, but also, as we will see, environmental impacts. So these are some of the targets that are set in this Bangkok Declaration. So alongside this, we have the number of publications, a number of very important pieces of work that identify the need to engage with environmental sustainability in oral healthcare. And I would like to draw your attention to this consensus, a joint stakeholder statement that was published about 2 years ago now by the FDI in collaboration with a number of researchers and authors from our institution and other institutions around the world. This is an open access publication, and key to this is that it identifies powerful and structured strategic actions for each sector of environmental impacts right across oral healthcare, transport, procurement, materials, education, waste, clinical practice, legislation, etc. And this was agreed by consensus by experts from across all sectors: academia, industry, allied professions, NGOs. So really, it truly is a consensus document that identifies what the problem is, these dimensions and the size of the problem, and importantly, strategic actions that we need to engage with. I come back to our framework, the delivery of good oral healthcare, because this we have identified is absolutely key to prevention. I beg your pardon, to environmental sustainability. And you see I've got my little yellow cloud of the key messages I'd like you to think about as the presentation proceeds. So effective preventive care regimes, good operative practice, integrated patient care, and professional ownership. These, as you will see in a moment, lead to low use of resources, low carbon footprint, and low waste and pollution, all of which are the key stakes that hold up, underpin environmental sustainability. How do we know this? Well, we always anecdotally realize that clearly if you do less dentistry, you can have a reduced impact. But we wanted to put some numbers to this. We did an LCA, life cycle assessment, and we identified, and that's been published in this presentation, in this paper here in Journal of Dentistry last year. And I'm just going to give you a very quick snapshot of this. So I'm going to take you through two extreme patients, patient A on the left-hand side of this screen and patient B. Both patients are 50 years of age. Patient A, as you see, has very little disease exposure, maybe some bit of gingival recession and tooth surface loss associated with that physiological process of aging, as you would expect in a patient of that age. Patient B is a very different situation. We have a patient here that has had extensive amount of treatment over the years, a lot of repetitive treatment that has progressed from small lesions to large lesions, large restorations, endodontic treatment, crowns, extractions, prostheses, periodontal conditions, etc. You will see essentially that the patient on the left, by virtue of the very good oral health and no active disease, the environmental impact is very low. And I will take you through some figures of that in a moment. Patient B, on the other hand, is quite the opposite. I said there are two extremes: poor health, failing dentition, active disease, extensive restorative treatment, and high disease risk factors. This patient presents with high environmental impact. We've actually, in the publication, all the data is embedded, but essentially the message is that, firstly, the first message is that both patients have an environmental impact. The second important message is that the environmental impact of the patient on the right-hand side with a high need restorative care and high disease risk presents with an almost 10 times greater carbon dioxide emissions equivalents than the patient on the left. So patient with a low need has an environmental impact, but it is sustainable, it is mitigated. And that's the difference between the two. Now, let's not just think of these two patients. Let's multiply this by 8 billion people worldwide. Imagine the environmental reduction and how we can mitigate these impacts if we take the approach of good preventive oral health as the patient on the left across the globe. It will make a phenomenal impact. So we can marry both concepts together. We can marry good global clinical care that delivers maintenance of health and prevention of disease, because that is what we want to achieve. When most preventable diseases are about maintaining that health and preventing disease. And we can marry that with our environmental sustainability strategies that we know are actually centered around good oral health. And both together will deliver oral health care that's environmentally sustainable. And that is what we want to try and achieve. The great news is that we don't need to do anything particularly exciting or magical. So we can do this by engaging with good quality oral health care. And we know that the single most effective way of reducing our environmental impact, as I have mentioned briefly, is through source reduction. The less we do, the less the environmental impact. And right across the supply chain, less materials, less packaging, less fabrication, less energy, less transport, less clinical care, interventive clinical care, and as a result of that, less waste. And we know that these are the concept of reduction is very well established. It's very well established both in energy and waste, where if you look at these two inverted pyramids, we have energy reduction and source reduction as the two most preferable strategies for environmental sustainability across all sectors, whether it is the building industry, the clothing industry, transport, and indeed oral healthcare, the same. So we want to reduce the amount of energy and we want to reduce the amount of stuff that we use. Reduction is the single best way to limit environmental impact. So how can we reduce that? Well, I come back to our framework. And this framework is published on the FDI website, and it's interactive, but you can also download it and print it as a poster. And the 4 domains: preventive care, operative care, integrated care, and ownership of care. And all of these together will lead to fewer appointments with reduced carbon dioxide equivalent emissions and less waste and pollution. I'm going to spend a couple of minutes just taking you through this quite briefly. Let's consider the restoration of the posterior tooth. Firstly, on the left-hand side, you see the initial dental caries lesion, and on the right-hand side, this tooth, some years later, has been after restoration. This is a concept that all educators are very familiar with, and that is the restorative cycle, where we are presented with an initial dental caries lesion on the left-hand side, and then at some point, a clinician makes the decision that a restoration placement is required. The moment we've done that, we have condemned the tooth to restorative cycle, where we have different elements of damage to the tooth and the restoration, whether it is structural degradation, increased stress fields, failure of the restoration, and eventually restoration replacement. The restoration replacement brings about further loss of tooth structure, and on we go in this cycle. Some of these causes might be due to other change in physical properties of the material, the tooth, other destructive lesions, etc. The bottom line is that at some point, that restoration grows, gets bigger, becomes damaged, and starts taking over most of the tooth, significantly compromising its structure and its viability. So we know that multiple restoration replacements reduce longevity. And in fact, perhaps most of the treatment we do nowadays is restoration replacement. And that in itself carries a significant environmental burden. Eventually, we can only go around this restorative cycle so many times before the structural integrity or the functionality of that tooth is obsolete and it has to be extracted. And that brings about huge social, financial, and personal well-being consequences, and also huge environmental consequences, because of the amount of treatment and patient visits and resources and energy that has been required and investment that has been invested in trying to retain this tooth and thereafter any treatment that's required following its extraction. So this is how we end up with a patient like this, where we end up with a patient that's had every single tooth has been through the restorative cycle multiple times and leads to high treatment needs with very high levels of very high level carbon footprint and single-use plastics. So we need to engage with prevention. Prevention, and I'm not going to go through this in detail, through oral health education, oral hygiene measures, or healthy diet. Prevention of not just caries, but all the preventable diseases in oral health, tooth surface loss, periodontal disease, oral cancers, and tooth loss. These are largely preventable for 90% of the population. And if we leave them untreated, these are the type of numbers that we come across. These numbers shouldn't exist today in 2025 in our world. There's some very simple messages. Preventive caries is preventable. But still we see a lot of active caries, recurrent caries, secondary caries. And we can do this there are a lot of different strategies in the market that help us prevent caries. We as professionals, we should really engage with this in a very vigorous way, because it is the single best way of preventing disease, caries, and also reaching our environmental sustainability targets. Remember that prevention of preventable diseases is few interventions and reduced impact on the environment. What about operative care? Well, it is all about doing things well, isn't it? It's about doing things. If we need to place a restoration, let's do it really well, so achieve a high quality, predictable, and durable outcome that will not require replacement and that will not be embedded in that restorative cycle. So if we're placing a restoration, follow guidelines, follow protocols, do everything we need to do according to the best teaching, the manufacturer's instruction directions for use, and best professional guidance. Don't make it up. Don't pretend you know if we don't know. Let's just do things really well so that we achieve the best outcomes for that restoration or that treatment procedure, whether it's periodontal care or any other procedure. So make it built to last, and that is the best way of achieving fewer patient journeys, less material use, higher patient quality of life, and better for the environment. And if we do these things well, as these images suggest, these restorations can last a very long time. These are restorations that were replaced with resin-based composite, and 20 years later, they're still looking very functional and effective. Integrated care is all about joined-up thinking, bringing things together in terms of structured treatment plans, active patient participation, and managed treatment appointments. Again, active patient participation in health education messages, managed treatment appointments, maybe through teledentistry and digital platforms, and also structured treatment plans. So we plan things in a logical, sensible way so that we're minimizing the number of patient journeys and perhaps bringing together family appointments, so we also mitigate on patient transport. Patients need to be part of the story. We can't pretend that we as professionals, we know everything and we can do everything for the patients. Patients need to be in the middle of the story and be co-creators and co-managers for their own oral health. But now patients will be even more interested in knowing that through a preventive approach, they will be actively contributing to mitigating the environmental impact. And that's a very exciting message for patients. Ownership of care. Well, this is about learning and developing our trade, basically, being the best we can, lead by example, engaging with everything that we do with good clinical governance plans, and ensuring that what we do well and predictably well, so that every time we're achieving the same high level standard, and getting involved with colleagues the same as we are today, and research project, collaboration, participation. Essentially, ownership of care is about engaging at all levels and being your best. So it is about preventing and providing excellent operative care, plan and engage and own what you do. So this ownership element, which is as important as the other three domains. So my last summing up message here is that we, through the provision of good quality oral healthcare, we want to move away from reactive and unpredictable disease management that perhaps we have been doing for many years, but really has no place today in modern oral health care, as we've seen in the strategic documentations that we've identified. And also, in this way, moving to proactive, good quality oral health that is well thought through, and that as a result of that is also environmentally sustainable. This is where we want to go to, and we know that we can bring both together very effectively. My last take-home message is environmental sustainability is grounded in the provision of good oral healthcare. Hence, my starting title, Something for Nothing. You get environmental sustainability simply by doing your job well. Thank you very much indeed for your attention.
So following on from excellent presentation from Professor Nicholas Martin, I'll be presenting our approach in Sheffield to embedding environmental sustainability in our undergraduate dental curriculum. I'm a clinical academic at the University of Sheffield. I'm also representing the Association for Dental Education in Europe. I'm part of the Graduating European Dentist Curriculum Task Force, and within that role, we develop a lot of curriculum guidelines, learning outcomes, and assessment guidelines as well for educators across Europe. So I got involved in this topic through education, really, and we're aware that dentistry continues to evolve, as was emphasised by Dr. Faizan. And the way we teach dental students has evolved significantly as well over the past, many years. And I was aware by the work by Dr. Brett Duane of the significant environmental impact of dentistry, as Professor Nicholas Martin mentioned, and also just purely as a clinician, understanding the amount of waste that we produce in every single clinical encounter. And this kind of drew my expertise from education and linked it to environmental sustainability. And dentistry, we've been through numerous cycles of change. The curriculum's evolved a lot over the past few years. Things historically that have changed, for example, the advent of adhesive dentistry, we've had to embed that into our curriculum. A greater focus on ethics and professionalism, certainly a professionalism assessment of our dental students. And environmental sustainability has came up as a key thing that we need to incorporate into our programs and ensure that our students and graduating professionals are knowledgeable and capable in this area. And I was really interested in establishing how do these changes occur in the curriculum? How can we modify our curricula to incorporate and teach environmental sustainability effectively? But the key problem was that professional knowledge of the topic is still very low. But we know from the previous work that raising awareness through education at all levels is absolutely critical. And this informed my research question, how can the dental curriculum evolve to incorporate environmental sustainability and planetary health? And this informed some aims. The first was to develop and validate a model for curriculum development using environmental sustainability as a case study. And through my work at AD, we developed a model that we needed to test, and we used sustainability across all of these levels to demonstrate an approach to incorporating a new topic in the curriculum. And sustainability was seen as such a critical aspect because we need to deliver it across all years of our programme to ensure that students come out with attitudes that are appropriate for delivering environmentally sustainable care. So I'm going to be talking through all of these steps of the cycle that you can see here, but it commences with curriculum mapping and then moves on to situation analysis and needs assessment. We then need to define learning outcomes for environmental sustainability. So what do we expect our graduates to be able to do when they finish their 5 or 6 year program? We then need to select appropriate teaching and assessment methods to embed this topic. And then we need to develop content and then implement the change. And finally, evaluate how effective our initiatives have been. So I'm going to talk through all of these levels. So step one is curriculum mapping. And this hasn't really been a research output from the work that we've done, but it's an essential starting point because this map gives you oversight of the curriculum. It gives you oversight of the program, what is being taught, what profile or learning outcomes are we asking our graduates to achieve. And it also provides you with some opportunities in terms of how we can plan to strategically implement sustainability across the length of our program. And it will also give you insight into areas of overlap and perhaps areas where you can remove some teaching to increase the resources to teach the topic. But the next point was moving on to developing a situation analysis and a needs assessment for the change. So our change was to embed environmental sustainability in the curriculum. And actually, because we're working at a European level, the European dental education picture is very complex. There are no real strict regulations on how dental education is delivered. So before we started this change, we actually needed to carry out some initial work, some scoping work to understand what is the context in which we're working to make sure our guidelines and approaches are applicable. And this commenced with a scoping review as part of the O Health Edu project, which included 8 university partners from across the European continent. And the scoping review informed some data collection processes in the form of surveys, where we went around dental schools and essentially established what is currently going on, how are their programs structured. And that provided very useful information beyond sustainability, but principally around program length, the use of technology, faculty numbers, and clinical contact time. But it also included an element of environmental sustainability. From this work, we then moved on to some focused needs assessments for sustainability. And we carried out a survey in the UK and Ireland across all dental schools to establish what is currently going on. Are they currently teaching environmental sustainability? But importantly, if they aren't, how can we identify where they're struggling? And again, this will allow us to tailor resources and guidelines effectively. So within this work, we achieved 100% response rate, and the take-home message was that most schools aren't currently teaching environmental sustainability. But we developed some principles in that it should be taught longitudinally across all years of the programme if possible. Because environmental sustainability is an attitudinal matter, we need to develop it and reinforce it over a longer period of time. And it was also highlighted within this study that there's a real lack of clarity regarding how we can teach sustainability in clinical spaces. This then moved on in Europe as part of the AD conference, and we really wanted to focus here on the challenges that educators are facing and to develop some strategies to try and overcome these. And this work was completed at the AD conference. It was a mixed methods approach where we used a survey but also a focus group type intervention. And from that, we established 3 key barriers that we needed to overcome to deliver this curriculum change. The first was a very common thing, I think, as educators that we always see is that we simply don't have enough time in the curriculum. We're always asked to incorporate new things into the curriculum, and very rarely are we asked to actually remove things. So time constraints was a key issue. Also, a lack of knowledge or expertise to teach the topic that was felt from a faculty level, and also a lack of practical guidance in terms of how do we do this in a step-by-step manner. And then the group decided on what are the opportunities we can embed to try and overcome these barriers. The first was to think about embedding the topic into existing events. So instead of designing brand new teaching events, which is not feasible in most contexts, can we embed this topic into our existing teaching, into existing practical teaching and in lectures as well? To overcome the issue of a lack of knowledge, it's clear that we needed to develop and share resources across institutions, and then we need to publish examples of practice as well. So all of this work across multiple geographical areas really informed our approach and gave us some fundamental philosophies that we needed to start working on. And this was a fundamental starting point for the project. We also, from a lot of different, again, countries and regions, had a lot of publications around the student voice, but also locally in Sheffield, we worked with one of our fourth year dental students, and they carried out a survey across all UK oral health professional students to establish the student voice on this matter. And similar to previous findings, it was overwhelmingly in favour of the need to teach this topic in the curriculum. And this is where we move on to stage 3 and 4. And at a European level, we developed learning outcomes for environmental sustainability. And this was published as a large author list across numerous institutions. In total, within that publication, we wrote and developed 14 different learning outcomes for environmental sustainability, and these serve as statements of what we expect graduates to be able to do. Locally in Sheffield, we selected 3 learning outcomes for environmental sustainability in dentistry, and then from there, we developed learning and teaching methods. So we realized we need to teach the topic at 3 levels. First of all, we need to teach core environmental sustainability and planetary health content because a lot of our students come from very diverse backgrounds. They don't always have the same pre-university kind of education on the topic. So we realized quite quickly we need to establish some teaching early in programs regarding core environmental sustainability. We then need to teach the topic as a part of dentistry. And again, this comes into the challenge of curriculum space. We need to teach it alongside what we currently do. It's also very sensible to do it in this manner because we should ask our students to think of sustainability as a part of dentistry, as a part of the procedure. So if they're learning about orthodontics, if they're learning about oral surgery, if they're learning about public health, sustainability should be embedded where appropriate at all of those different stages. And then, of course, we need to have practical application of the topic when our students provide clinical care for their patients. And from these 3 levels, from the learning outcomes, we established our teaching and assessment methods. First of all, we adopted the FDI Sustainability in Dentistry MOOC, which is an open access resource that Professor Martin mentioned previously, and also we deliver a standalone lecture to students regarding environmental sustainability and planetary health, again to provide that core knowledge base. We then incorporate sustainability into existing practical and lecture-based teaching events as single or groups of slides, just an addition to current teaching, or to look at teaching through a different lens. And then for practical application of the topic, we've embedded it into our clinical skills programs, and we also developed some case-based discussions around the topic of environmental sustainability in dentistry. Again, to give students that practical application of what can they do. Sometimes the topic of sustainability, you almost feel, students sometimes feel hopeless in terms of you can't do anything about it. So all of these sessions aim to really empower students to realize that good quality oral health care is sustainable. You can do this by just doing the best job you possibly can do, as Professor Martin mentioned in his presentation. Stage 5 was looking at how we develop content because again, one of the key challenges we realized when we went out to educators was that a lot of educators don't feel that they have enough awareness to be able to teach this topic or enough confidence to teach the topic. And from that, we knew really that we needed to go and develop some content specifically for educators. And this is some work that we did in collaboration with the FDI World Dental Federation. And we developed some evidence-based content and we mapped this content to all different curriculum subjects. And that included clinical disciplines, but also non-clinical subjects as well, from basic science, pharmacology, things like that. And the evidence-based content went through a period of validation to ensure it was appropriate. And we did this through students to ensure that the content was understandable to them. We did it through the subject experts to ensure that the mapping process was appropriate. And then we went to the educational body with AD to ensure that the educational theory and rationale behind this was appropriate. And this resulted in the publication of a lot of key messages that took the form of slide decks with the FDI. And these are also available as an open access resource where educators can go into the web page, find their relevant discipline, whether it's basic science or dental biomaterials, for example, download the slide deck, which usually has around 25 to 30 key messages in there, and take out a number of slides and apply it to their teaching, being confident that they have evidence-based statements regarding environmental sustainability in dentistry. And this is what we asked our educators to do, was to access the slides and incorporate it into their teaching where they see fit. And this led us to the final two stages, which was actually to implement this change, develop a plan of action, and also evaluate how effective our implementation strategy has been on the key outcome, which is with our students. And this was published in the Journal of Dentistry as well. And this was the plan of action. So we had the four teaching events that I mentioned running down the left-hand side of the table here. So we had the FDI MOOC, the standalone lecture. We then had embedding the content into existing lectures and then case-based discussions. And it ran across all years of our 5-year dentistry program here at the University of Sheffield, and also in our dental hygiene and dental therapy program as so. And in order to evaluate how effective our approach was, we needed to establish baseline measures and then evaluate how these changed after our teaching interventions. And we did this via a survey to assess changes in awareness, attitudes, and knowledge of environmental sustainability in dentistry. And we also looked at some general pro-environmental attitudes and also perceptions of how easy it is to implement environmental sustainability in dentistry. And this was a 41-item questionnaire that was developed from previous publications. And we delivered this before teaching and at the end of the semester after the teaching had taken place. And we achieved a 90% response rate from both baseline and post-intervention surveys. And this was across all of our undergraduate students, both in dental hygiene and dental therapy and in clinical dentistry. So we had quite a large pool. And in the analysis, we had 270 participants that were included, which was 72%. We did lose some students because we had to match them with a unique code, and sometimes the codes didn't match, but we had 270 participants overall. And the demographics were representative clearly of our group, of our cohort of students. And key headlines from the results were that we saw significant positive changes in awareness of environmental sustainability, in attitudes, and also in knowledge within a fairly short period of time of around about 6 months. So we'd hope, over a full curriculum cycle, whether that be 4, 5, or 6 years, we'd see an even greater change from there. So in conclusion, for my presentation, our project demonstrated a systematic research-centered approach to embedding a new topic in the curriculum, and it was essential to have a collaborative approach with stakeholders, internal and external to the school, to maximise the applicability of any resources that we've produced. Thank you very much for listening.